Okay, so today I want to talk to you about something very interesting, something that interests me. And in our discussion in homeopathy, this idea comes up very easily. What symptoms are important to evaluate? And Hanuman, it's a very interesting portrait of Hanuman, this is one of my favorite, had said in one of his aphorisms some four very important words: striking, singular, uncommon, peculiar, characteristic signs and symptoms. Let's see exactly what he said. He said that in one of his aphorisms, in 153 aphorism, he writes, in this search for a homeopathic specific remedy, that is to say, in this comparison of collective symptoms of the natural disease with the list of symptoms of the known medicine, in order to find among this artificial morbific agent corresponding by similarity to the disease to be cured, the more striking, singular, uncommon, peculiar sign and symptom of the case of the disease are chiefly and most solely to be kept in view. And then he concludes, for it is more particular these striking, uncommon, peculiar, strange symptoms in order to constitute this shows most suitable for effecting cure, while the more general, undefined, vague symptoms like loss of appetite, headache, debility, restlessness, sleep, discomfort demand little attention when vague and indefinite character. If they cannot be more accurate, this is a very important word, accurate. We often use the word exact, but if they cannot be more accurately described as symptoms of such general nature are observed in every disease and for every drug. So we need, coming back, striking, singular, uncommon and peculiar. Accurate. There is accuracy here. What is needed for this kind of thing is what in 83rd aphorism Hanuman says, the individualizing examination of the case of the disease, for which I shall only give in this place general directions, of which the practitioners bear in mind only what is applicable for each individual case of disease. Demand. So what is needed from a physician? Number one thing, freedom from prejudice. All our fixed ideas, ये ऐसा हो सकता है, ये वैसा हो सकता है, forget it. Sound senses, your observation power, your hearing capacity, your smell capacity, your touch capacity. Attention in observing. He can't be very restless. He can't think about his wife, what wife is shouting at me, can't think about the husband, can't think about the family. Focus. And fidelity in tracing the picture of the disease. Nash also said something very interesting. E.B. Nash. He's written this in the remedy Nux Vomica in his Nash book. In actual practice, there are two kinds of cases that come to a physician. Just see how interesting Nash has said. One is the case that may be prescribed for with great certainty of success on symptoms that are styled characteristic and peculiar. So one type of cases where very characteristic symptoms are available. The other is where all the cases there are no such symptoms appearing. There is only one way to hunt the remedy in its pathogenesis contains what is called the taut ensemble of the case. What do you mean by taut ensemble? Means all together, meaning assemblage of parts or details of whole work, overall effect, like a totality. Taut ensemble means totality. Very interesting. So coming back to the main idea why I wanted to talk to you guys about this is the art of the homeopath lies not just in this theoretical part, but the art lies in the clinical eye, to develop that eye to see that characteristic peculiarity. I'll give one example. This patient had come with a headache. So I asked him, can you tell me a little bit about your headache? He said, doctor, when I study, I get headache. Okay. You have to probe a little deeper. Okay, tell me about the headache. This always happens before the exams. Okay, tell more. When you say before exams, what do you mean? So, okay, before exam means that whenever I'm studying before the exams, I get this headache. Okay, tell me a little more about this. Oh, doctor, I get this numbness, sudden numbness, when I read for a long time. So the symptom, which was headache whenever I study, comes to the symptom numbness from reading. This is the peculiarity. This is the striking, singular, uncommon, peculiar symptom. And the remedy there, carbolic acid. That's what helped this patient. Fantastic. Because this is what defines one headache from another headache. The most important idea which I want to tell you, probing the peculiar. The idea is to probe little deeper, little deeper, little deeper, little deeper. The more deeper you go, the more individualistic it becomes. The peculiarities can be at different levels. It can be at the chief complaint. It can be at the modalities. It can be in the exciting factor. It could be in the cravings. It could be in the aversion. It could be sweat, physical genitals, menses, dreams, the state of mind, often even in the past history. So I want to give you some examples to know how to pick up that striking peculiarity. It's a very interesting case of toothache. And the only symptom I got in the toothache is that the toothache, generally, eating aggravates the toothache, isn't it? That's a common. This lady told me that toothache is better by eating. So I put it in the reference work, neuralgia or toothache, eating ameliorate. And there was only one remedy here that was given in Allen's handbook, you can see there, rhododendron. Rhododendron. So finding that peculiarity, sometimes sharp, just one symptom, is what the homeopath has to look. It's like a search. One of the patients who would always come to my clinic, and she would come and tell, doctor, what kind of clinic you have? Look at the door, look at your shirt. Always wanting to gain attention. She received the remedy Paris quadrifolia. So she was just talking, and whenever she would talk, she would enjoy her talking. Talks pleasure in her own talking. Another interesting case I want to tell you. This is a case of polycystic ovarian disease. So she was not getting periods for a very long time, 3-4 months. So I asked her, tell me all your illnesses from past. So in the past history, I had asthma, and this asthma would always be more when I lie down, and it would get much better after warm drinks. This was interesting because she was not giving me any symptoms of the polycystic ovarian disease. So I went into the past history and focused there. She had some other symptom like cold would aggravate, warm drink she would like. This warm drink ameliorate, this was there about 10 years back. And there was no other symptom in the case. This actually gave me the remedy. Focusing into past history. So, respiration difficult, warm drink ameliorate. Only one remedy in Kent repertory, spongia. Spongia has an action on the ovaries, on the glands, and spongia totally helps the patient. So sharp symptoms. I want to tell you, don't take vague symptoms. No broad symptoms. I feel dull. I feel restless. I feel little chilly. This little, it doesn't work. It has to be accurate. My teacher, Dr. Sankaran, tells me exact. My teacher, Dr. Sarkar, tells me it has to be there in repertory. There's one of the patient who I was treating in fever, and he was doing very well. I believe on, I think it was on arsenic. Suddenly the mother told me that after fever, he stopped talking to anyone. Anyone talks to him, he doesn't look. Anyone gives him food, he doesn't look. He's totally kind of closed himself in the room. So the idea is not that one remedy is helping, you are happy. If the state changes, the remedy changes. And so I found a very interesting remedy. Indifference, fever after. One of the remedies there was China horse. Very interesting. One patient would tell me, I get a lot of pain in the knee. I said, okay, what happens and what do you do? He said, I feel, I press it. Okay, so does the pressure help you? He said, no doctor. When I press, I get dakar. Eructation, pressure, painful part. So I was seeing if the pain is better by pressure, But the patient gave me some other symptom which was more important. It's called a serendipity. So sometimes you ask something, expecting something, you get totally something different. This is the most peculiar thing. One of my drivers would tell me, and he had come up with the accused. He said, "Doctor, whenever I drive car, my back pains a lot, but when I drive like this, I feel better." So I said, "Show me, show me." He said, "When I drive like this, I feel better. When I drive like this." So sometimes you have to ask the patient to show the action. So I found an interesting remedy for him. Pain back, sitting bent aggravate, sitting erect ameliorate. Chelidonium. So exact. I want to tell you, my friends, it's the sharpness and the accuracy that is needed. This is another acute patient that I was treating, case of pancreatitis. She would tell me, she would describe me the pain. It's excruciating pain. It's a cramping pain. I would ask her about the modalities. What would increase the pain? She would tell me, when I listen to music, I feel better. I divert my mind, I feel better. But when I think about my pains, it aggravates. So pain, abdomen, thinking aggravates. And it had oxalic acid. Oxalic acid, one of the main symptoms is occupation, diversion of mind ameliorate. So I'm just giving you some very, very short cases and how to just find the peculiarity. One patient with otitis, with lot of discharge. I said, okay, what is a discharge? He said, I don't know. So I told them to put it in a box and get for me. And when I smelt it, it was very, very fishy. That's the remedy he got. Ear discharge, offensive, fish-like. Tellurium. Fantastic help. Sometimes you don't get characteristic. Then what to do? So this case I will try to share with you. It's a case of an old lady. She was on Kali iode, cold days of osteoarthritis, doing very well. But suddenly she developed she's about 80-year-old, lot of unconsciously she would pass urine. And I would sit with her, but I wouldn't get any symptoms. Find a very interesting remedy there. So bladder, involuntary old people in women. And one of the remedies there is Aristolochia clematitis. And this fantastically helps. So sometimes, in cases where characteristic is not available, you could possibly see a clinical rubric. But I want to kind of tell you all that in every case this will not work. So homeopathy is like that a little bit. One has to actually look at studying a remedy, studying a case totally individually. One of the patients would tell me, I get headache. I said, when do you get headache? He said, doctor, I get headache whenever I don't go to work. I said, okay. When is that? He said, especially when there is a holiday, I get a headache. What do you mean? Especially on a Sunday. So very interesting, you can see. Head periodical every Sunday. And the remedy he got was sulfur. Always on Sunday. Sunday headaches. Monday headache is iris. Similarly, perspiration. One patient would tell me, I get perspiration. I said, when do you get it? He said, I get it here and it stains it white color. So there's a rubric. Perspiration staining white, selenium. So the peculiarities are everywhere. You have to probe. So what I want to tell you, just observe. Pyar se suno. Listen. Listening is the most important thing to find a peculiarity. So understand the peculiarity. Develop a clinical eye. My teacher L.M. Khan from Calcutta would tell me, more the disease is away from the characteristic, more it is exact. So for example, in the case of PCOD, past history of asthma you gave spongy and that helped. This is the peculiarity. Probe the peculiar. And then use repertory, use reference works, use materia medica, use different techniques to find the peculiarity. This is what I want to tell you. And you can write to me about your ideas and hope these ideas have been useful.